Good morning, everyone. It is now 9:15. We do not yet have a quorum, but we're going to start this meeting. And I thank everyone who made who was able to beat the traffic. There's apparently a immigration protest at the federal building. So I think a lot of the folks who are coming to this meeting can't get into their parking lot. So hopefully they'll get here soon. But welcome to our regular meeting of the Health, Mental Health, and Education Committee. We are in room 1010 in City Hall. And anyone who wants to make public comment, please fill out a speaker's card and please bring it up to the front. And we have no public comment card, right? I'm going to open up the public comments at this point. We have no public comment card. So we're going to move to item number 1. Can you read?
Item number 1 is a City Administrative Officer report relative to a request from the Los Angeles Department of Aging for authority to execute amendments to contracts with St. Barnabas Senior Center of Los Angeles and with Pacific Region Older Adult Services and Information System to operate a mini multipurpose senior center at the Sandra Cisneros Learning Academy located at 1018 Mohawk Street in Los Angeles.
Thank you, Mr. Randall. This is a standard joint use contract for a great new senior center in our neighborhood in Councilman O'Farrell's district.
Thank you, Mr. Chair. Thanks for putting this on the agenda. We eagerly anticipate the celebration of a new senior center in Echo Park that has been about 10 years in the making. We are going to enlist the services of St. Barnabas to administer the programs for our seniors. That area in particular is lacking in availability of resources for seniors. And this new senior center, co-located with a school, was built out for the purpose of a community use. I'm just delighted with the Department of Aging and for your incredible work to help make this happen. And Marco here with the Department of Aging, thank you. And Star Parsamian on my team who has helped make this a reality. When we get this through council, and we have the dedication next month, we'll have a big celebration of providing yet another facility for our seniors that one day all of us will get to enjoy. So thank you, Mr. Chair.
Thank you. This is great. We need more senior centers, more green space, more everything in our communities. Mr. CLA, so we just take this as an informational item right now, or do we take a vote?
The committee can adopt it as a communication from the chair, and it would be moved to council with a public hearing would be required in council, but if another member were to come to committee for a quorum right today, the committee can reconsider the item and it would be adopted.
Okay. So at this point, I'd like to move. I'm sure we'll have another council member join us shortly, but till then, we'll just take this as a communication from the chair. Okay. So moved. Item number 2.
Item number 2 is motion Rue O'Farrell relative to a request for the Personnel Department to report on the status of any current citywide health, safety, and wellness plans that reduce workforce injuries, improve recovery times, and keep city employees healthy, as well as recommendations for implementing any new plans which may be needed.
Great, thank you. This item was heard last meeting, and we went over time a little bit, and we did not have a quorum, and we still don't have a quorum right now. So we'll move this. Well, and actually, we had all the. Oh, we have quorum now. Okay, we have Councilmember Buscaino joining us. Now we have quorum, but at the last meeting, we did ask the mayor's office to give information to all the committee members. So I'd like to approve this motion on consent with the instruction that the Personnel Department and other relevant departments related to the city's workforce wellness and safety work with the mayor's office operations innovation team to come up with reform recommendations on this subject and return to this committee with an update in 60 days.
So moved.
So moved. Second by Buscaino. Yes. Thank you. No, and there were no comment cards on item number 2. Can we go back to item number 1, Mr. CLA, and open that up for a vote?
Yes, the committee can reconsider that item.
All right, so need a motion to reconsider item number 1?
We'll reconsider item number 1, and now that Mr. Buscaino has joined us, we will hopefully unanimously support moving this for full adoption to council.
Move the item second.
Great. So we open it up and then we vote on it, right?
Yep.
Moved by O'Farrell, seconded by Buscaino. Thank you. Item number 3.
Item number 3 is a city attorney report and ordinance relative to adding sections and amending the Los Angeles Municipal Code to prohibit the use of smokeless tobacco at event sites for organized sporting events and at city parks, and to add definitions related to smoking. This matter, Arts, Parks, and River Committee waived consideration of this item.
Thank you. We were all thrilled to hear this item last September in our committee, and we wanted to make sure that we were setting the right example for our kids at our Los Angeles sporting venues. Tobacco of any kind is a proven killer, and we know that seeing others use tobacco products is the main way children try to emulate and choose to use it for themselves, especially when they see their sports heroes doing it. This ordinance will take away one or more ways kids become exposed to tobacco products. And I would now like to call up, do we have a representative from Councilmember Huizar's office? Oh, yes, just made it. Mr. Kevin O'Flaherty. Oh, no, Councilman Huizar's office, who authored this motion.
Thank you so much. Hi, Martin Shalagada, the Policy Director for Councilman Huizar, and got here just in time because of all the craziness outside, but appreciate your attention to this matter over the past few weeks and months. I think it's been a great partnership of the committee and Mr. Chair. I think a great example of how this committee, relatively new committee, can take on issues that really are going to have lasting impact for Los Angeles on the health of our residents here. Just wanted to say on behalf of Councilman Huizar how much we appreciate your time and attention to this matter. We're obviously in full support of what you're doing and appreciate the partnership of this committee toward a healthier Los Angeles. Thank you.
Great. This was, the city of LA's got nationwide attention on this one, and I think, like many things, we're leading in this arena. Could I call up the city attorney and Recreation and Parks to come up and talk about give us a quick briefing on the ordinance?
Good morning, Council. Selena Porras from the City Attorney's Office Tobacco Enforcement Program. We drafted the ordinance to fulfill what the motion requested, and in doing so, just wanted to point out that we did create a new provision, 4150.1, that would apply to all locations in which organized sporting events occur. And then we also amended 63.44B24. That was the existing smoking prohibition for city parks. We added smokeless tobacco. So the result is that you can't use any form of tobacco, whether smoking it or using chewing tobacco, smokeless, in other words, in a city park. And so that is the ordinance that we've presented and asked for your passage.
Great.
Good morning, Council. Javier Solis, Rec and Parks. We currently have many signs in our parks that clearly state no smoking anywhere in the park. We will modify those signs to make sure that no type of tobacco product will be prohibited in park use. So that's going to be how we're going to approach this matter.
Great. I'm going to, does my colleagues have any questions?
No. I just want to thank Councilmember Huizar for his leadership on this, and you, Mr. Chair, for carrying the torch forward to make this happen so that Los Angeles becomes the example for the rest of the country on banning and regulating tobacco use. It will end up saving lives. It will end up preventing lots of misery and physical ailments to our youth and our general population. So I'm very thrilled with this an additional step in the right direction. Thank you.
Mr. Buscaino, do you want to say? Okay, good. Now, before, I want to add public comment, too, as well. Could we have Kevin O'Flaherty from the Campaign for Tobacco-Free Kids and Dr. Fielding, our former director of the LA County Health Department, Public Health Department.
May I go back now, or did you
Sure.
want me?
You guys could stay there.
Okay.
Yeah. Because I want to say thank you to all of you. Kevin?
Well, I may just stray from my remarks. We are thrilled with the work that you've done here. I'm proud to be leading this national effort to knock tobacco out of the park. And Chairman Rue, we really appreciate your leadership. Other members, it's been really great. As you mentioned, the last time we saw each other, you passed this motion and sent it on to full council, who did the same. And so, before I say anything else, I really want to say thank you to all of you. And it's really great that Los Angeles is sort of stepping up, going beyond what some of the other cities have done. Tobacco-free parks is a bold new statement, and it makes sense. Anywhere that we have kids, we should try to restrict tobacco use. We certainly don't want to model it, and I just think it's a measure of the leadership that you've shown across the country in terms of addressing tobacco issues as they come up. We know that ball players aren't indulging in a harmless habit when they use smokeless tobacco. They're damaging their health. But the important thing here is that they serve as powerful role models to kids. And this will prevent them from continuing to start new generations of kids who get hooked on smokeless. And then even though they don't continue playing ball perhaps all of their life, they're stuck with this addiction that they got. And so I think that what we've done here today, what you're hopefully going to do today, will really take us forward. And the goal also isn't to pass this in 30 cities across the country. The goal is to get the league and the players to agree to get this out of the game, something they should have done years ago. And I think that you being the third city now and taking such a strong policy, we're going to have other cities in the coming weeks and months that are going to announce this campaign. And our goal is to get that agreement to occur in the next year. And you've been a big part of helping make that happen. So we, again, really appreciate your work here. And I'm open to answer any questions.
Dr. Fielding?
Thank you so much, Mr. Chair and council members. And I just want to say I think that the Tobacco-Free Kids has done a remarkable job as a great partner working with you and working with those that are most concerned about health and health professionals. I'm Jonathan Fielding. I'm a professor of health policy management and pediatrics at the UCLA Geffen School of Medicine and Fielding School of Public Health. And I was proud to serve for 16 years as the County Director of Public Health and Health Officer. I just think it's useful to remember the harms of smokeless tobacco. It is a dangerous, it is an addictive product, and it causes serious illness and can cause death. Many medical and public health authorities, including the National Cancer Institute, the U.S. Surgeon General, the U.S. Public Health Service, have concluded that these smokeless tobacco products are addictive, very addictive, and cause serious disease, including cancer. There are at least 28 cancer-causing chemicals in smokeless tobacco, and the International Agency on Research on Cancer and the National Toxicological Program have concluded that it is a human carcinogen. So we know that it causes oral cancer. It can require disfiguring surgery and worse. I'm sure you've all seen the pictures. It can cause esophageal cancer. It can cause pancreatic cancer, which is one of the deadliest forms of cancer. And it can cause many precancerous lesions in the mouth and gums and around that area. So the health harms are very, very clear. But the difficulty is that all players who use smokeless tobacco don't only endanger their own health. That would be up to them. You say, well, it's a matter of personal choice. But unfortunately, they provide a role model for the younger athletes who are coming up. And there's good evidence about that. The Center for Disease Control released a report showing that high school athletes use smokeless tobacco at nearly twice the rate of non-athletes. And in fact, among male high school athletes, the rate of smokeless tobacco use is particularly alarming at 17.4%. So we're not talking about a very uncommon problem here. It is extremely common, and every year it's estimated that over 500,000 kids between the ages of 12 and 17 start using smokeless tobacco. So these are really critical issues, and I think it's really important to realize that that there have been a number of studies that confirm this, and this study that was done in the University of California, San Francisco, made it very clear. The finding was professional and college athletes provide a powerful model for boys and young men to use smokeless tobacco by legitimizing chewing and dipping as an integral part of being a successful athlete. And the high levels of smokeless tobacco use observed in college and professional ranks are mirrored among adolescent athletes. So I guess the point I would make is that This is a contagious disease. It is contagious. When you see your idols using smokeless tobacco, you say, that's part of the persona that I want to be. That is not the persona we want our kids to be. And I really appreciate the leadership that you're taking. I think Los Angeles can make an important step by eliminating tobacco from baseball for good. It'll save many of our children for a lifetime of addiction. Thank you so much.
Thank you, Mr. Fielding. And you know, whatever Dr. Fielding says, he is renowned in the area of public health. Everyone listens. And you know, I am so excited about moving forward on this ordinance, and we will be voting it on City Council today. And this ordinance that also includes recommendations to the ACE program to make it easier for our peace officers to enforce this law. But, you know, again, as Councilmember O'Farrell said, really want to thank the leadership of Councilmember Huizar for bringing this to our attention. And of course, a big thank you to the City Attorney's Office and Recreation of Parks for working expeditiously on this issue to come before us. This is very important for everything that you guys said. Whatever we could do to prevent, discourage our youth from engaging in activities that are harmful to themselves. And in many cases, all they're trying to do is emulate and their role models. This is very important, and we are very happy that we are able to move forward with this today. And I have no questions. I just wanted to say a big thank you to everybody for working on this, including, of course, the Campaign for Tobacco-Free Kids. Thank you very much. And anything else we could do to support in moving the league, let us know. And my colleagues, do you have-
Good stuff.
I was just wondering, Mr. Chair, if I can, perhaps we can, I'd like to measure this the effectiveness of this ordinance by maybe an annual report on coming back to us to see exactly what we need to do to strengthen this moving forward, if indeed we're finding some loopholes throughout as we move on this ordinance. I'd like to perhaps come back to us and establish maybe an annual report.
Yeah.
And even if say like our park rangers, if we're not adequately staffed to address this ordinance, or working directly with park directors and other city resources, I know it's going to be a part of the ACE program, which is good.
Mm-hmm.
But maybe something we can consider.
That is a great idea. If we could, so would that be an amendment to the motion, or would it be a separate motion?
Mr. Chair, that could be an additional recommendation to report back with an annual report. The first recommendation would be to approve the ordinance, and the second is the annual report regarding the effectiveness in.
Well, just metrics and effectiveness to see how else we could, if we need to tweak the ordinance, or if Recreation and Parks needs some assistance or whatnot in enforcing this. Yes,
I
Dr.
have
Fielder?
a suggestion. I think one of the things that's most important here is the dissemination. So going to all the youth sports organizations, making sure that they know about this is going to be absolutely critical. In addition, it would be wonderful if one could identify a player who's currently using, and who's in the professional ranks, who then can become a poster child, if you will, a poster adult for this, saying, I stopped because I didn't realize the effect it was having on kids nationwide, but we all should stop. Not just at the ballpark. So I just think there's a number of things, and I would suggest if you have an evaluation, that you have an evaluation also of the dissemination, and make sure that people, all the way down to the lowest level, to the young kids playing t-ball.
Mr. Chair, Dr. Fielding, you just give me an idea. So we'll reach out to the Dodgers in San Casden and see if maybe one of the rock star Dodger players is willing to step up and be the poster adult for this cause. So we'll inquire.
Yeah.
And I think the Campaign for Tobacco-Free Kids, you already have a roster, and you guys have a lot of information, like the video that you shared with us at the last presentation. So we'll definitely work in conjunction with you. So
No, this is a great idea, Chairman, and we've actually already considered both in Los Angeles and Boston and New York. I'm sorry, Boston and San Francisco. This April will be the first games that are played in tobacco-free stadiums, 100% tobacco-free stadiums, and so we would like to reach out to, and we're going to do this through Councilman Weezar's office, and happy to engage you as well in the teams to try to really get positive stories out there. One of the Dodger relief pitchers last fall, when this passed, had a great quote in the local paper saying, I do a lot of charity work with kids, and I think about this because I use spit tobacco, and I wonder about the effect it's going to have on kids, and he said, I hope this helps me quit. So I think finding some players who are willing to make statements like that around April 1st or whenever the home opener here is at Dodger Stadium, it would be great to do that, and we would love for your assistance with that.
Great.
Thank you, Councilman.
And so we'll add that recommendation to the to report back in a year, and you could give us some of the metrics and some of your barriers or some of the effectiveness and outreach. You could give us a report back on how it worked out.
Yes, thank you.
Great. So we have no more comment cards, and seeing no objection, I'd like to approve this ordinance unanimously.
Yes, so moved.
So moved. Thank you very much. Thank you, guys.
It's in time for ABC to cover this.
And we should have
Drastic.
Should we have extended? Our last item, item number 4. Mr. CLA.
Item number 4 is City Clerk Report relative to the annual reporting of Anti-Smoking Trust Fund number 41Z for fiscal year 2014-15.
Thank you. I wanted to hear this item today as this fund was set up over a decade ago to house settlement dollars from the lawsuit the city won against tobacco companies. The fund is basically defunct now, with almost all the settlement dollars allocated previously and leaving a balance of around $500. So no further settlement dollars are anticipated as well. However, this provides a great opportunity to provide Recreation and Parks little help with the cost of installing new signs in relation to the new smokeless tobacco ban that we just passed. What I'd like to do is transfer the remaining balance, about $500 or so, in the trust fund to the Recreation and Parks Department to take any technical actions needed to close the account, and if desired, remove any municipal or administrative code sections related to it so that no more administrative overhead costs related to this account will be incurred by the city. Colleagues, have any questions?
Good. Mr. Rue, I just thought of something that I'd like to ask Ms. Porras and Mr. Solis. In 2014, we adopted the regulation of vaping and e-cigarettes to fall in line with the way we regulate tobacco use. So perhaps when you do the signs for our recreation park facilities and other facilities, maybe you could also point out the use of e-cigarettes is also prohibited. Smokeless tobacco, e-cigarettes, and all tobacco products, perhaps, just to be crystal clear?
Correct.
Yeah, since we're gonna modify the signs, I think that's an opportunity to update them with that regulation as well.
And I'm happy to work with Rec and Parks on that as well.
Terrific, thank
Excellent.
you.
Thank you very much. That's a great addition. And we have no... Bruce, go ahead.
Good.
Okay. And we have no speaker cards on this item, so look to approve with these added instructions, and seeing no objections, we move this unanimously. There's no other business before us, so this meeting is adjourned. Thank you to the departments and concerned citizens who joined us today. Thank you very much.